Today we are going to learn about adverse drug reaction. In short, we used to call ADRs. So what is ADR? It is an unintended or undesired consequences of a drug administration to a patient. So it means if a physician is prescribing a medicine to a patient and patient once after getting administered with that particular drug and patient comes up with some other signs and symptoms which is not at all desired or intended by the physician that he or she should come up with. Those reactions are called as ADS. So WHO has come up with a good definition for ADS. That is nothing but any response that is nauseous or unintended and which occurs at the dose that is normally used in humans for prophylaxis, diagnosis, or treatment of a disease, which is known as EDA. So, in a clinic or in a hospital or in a healthcare setup, there is a department which deals about the areas or drug related problems in their what in the healthcare setup. So that department is known as pharmacovigilance, or that wing is known as pharmacovigilance. So what is a pharmacovigilance? The science related to the dictation and assessment, understanding, and the prevention of adverse effect or any other drug related problems are called pharmacovigilance. Okay, so pharmacovigilance is nothing about if a department there is a department which deals with any of the drug related problems are called pharmacovigilance. Okay, so what is adverse drug reactions? And we learned about what is adverse drug reaction. So next comes up with classification of areas. There are five types of areas. So one first type A is augmented and type B is Bacillary. Then third one is chronic use. Then fourth one is delayed, and fifth one is end of the use. Okay, so these are the five types: the type A, type B, type C, type D, and type E. Uh, Types of areas and other areas also there that is comes with a dependency, laterogenic and teratogenicity, then carcinogenic, photosensitivity, and those kind of areas are also there. So first one, type A, that is augmentant uh, area, that is nothing but the drug is given in a normal dose as usually taken to a human being, and but it shows some unwanted reactions or some negative impact on the body is called it's known as augmented reaction. So for example, if patient is administered with warfarin and later the patient develop with excessive bleeding, that is one of the example. Another one, if a diabetic patient is usually patient is had usually used to have penicillin, but not penicillin, sorry, insulin, and in some occasion, once after having insulin or once after administered with insulin, the patient develop hypoglycemia. These are the two examples of type A adverse reaction. So next comes the type 2 or type B effects, that is better reaction, that is unrelated to pharmacological effect of a drug. It's not at all depends on pharmacological effect, but it's not at all predictable. Although doctors can't able to predict what will be the condition. Okay, so in augmented case that we can predict. If we are giving insulin, maybe patient will come up with what hypoglycemia. Or if we are giving an warfarin, then patient may come up with excessive bleeding. Okay, those are we can. just assume it. But here in wheat type, we can't able to predict. So there are also two types of buzzer what reactions. So first one is drug allergic reaction. Second one is idiosyncratic reactions. Okay. So first one, drug allergic reactions means it is depends on immunological mediator like immune response. We can very simply we can say that it's an immune response like IgM, IgG, IgA, IgE, and those kind of antigen antibody reactions. Okay. Then idiosyncratic means it's a genetic mediator that depends on our genes. Okay. So again, this type 2 reactions on base of drug allergic reaction, they are classified into again four types. So first one is anaphylactic reaction, second one is cytotoxic reactions, then arthros reactions, and fourth one is delayed hypersensitivity reaction. In anaphylactic reactions, that is based on the IgE mediated immediate reactions to certain drugs. Okay, so in anaphylactic means always we know that IgE is the IgE is the antibody which is going to react response in this reactions. Okay, so only expose of the same drug there will be antigen antibody reactions on the mast cell and release of histamines will occur. So if re-exposure of the same drug, if a drug is already given and the patient is again re-administered with the same drug, which is in that case there will be a reaction between antigen and antibody. So foreign particles, if we are administering to a body or in it's enters to a body, our that foreign particle they our body will detect it as an antigen, so antibodies will be forming. So this second time that same drug is coming back, this antibodies will think that is an antigen. Already they have released about histamines, and also those reactions will start up. The antigen will that antibody will going to react with this antibody or this drug and manifest as that itching, asthma, anaphylactic shocks, etc. In this, for example, penicillin allergic patients will feel so. Penicillin is one of the antibiotic, and which have a lot of many of the people have the penicillin allergy. So this is an anaphylactic reaction. Okay. So next comes cytotoxic reactions. In cytotoxic reactions, IgG, IgM antibodies are going to react with cell-bound antigen and cause activation of complement system and cause destruction of cells. Okay. Here you know that antibodies like IgM, IgG are the cause of this kind of areas. Okay, so comes the third one. Here nothing but uh, arthros reactions. There antigen antibody complex causes different kinds of symptoms like serium sicknesses, the like Steven Johnson syndrome in sulfonamide allergic patients. Okay, then if some people who is responds to having a what response against sulfonamide, they will come up with Steven Johnson syndrome. Everybody knows what is Steven Johnson syndrome. So no need of explaining about it. Then fourth one is delayed hypersensitivity reaction. Here T cells mediated reaction. There T cells are the main response behind this reaction. So in this condition, T cells will go into immediate the allergic reactions. So uh, due to the local anesthetic in contact dermatitis, okay, that is an greatest example. So yeah, I think you people got it what it is. So idiosyncrasy means genetically mediated. There, no need of seeing anything. Our genetic, what our DNA or gene is going to mediate these reactions against that particular drug. In some people, very few people or few individuals may having a different types of genotype means that genotype is against a particular drug. So those automatically they will have some problems with it. So for example, barbiturates cause excitement and mental confusion in some people uh, whose genotype is those just uh, different from normal genotype. They will have that barbiturates causes that in those people barbiturate causes excitement and mental confusions. So next comes main categories like type C effect, that is chronic. So adverse reactions after long term of therapy. In this case, that adverse reaction will cause uh, due to the long term use of a particular drug. Yeah, that is related to maybe dose or duration of uh, that particular drug. So in that case, one of the example is cushioning syndrome due to corticosteroids. In some individuals may have this kind of a reaction. So I think you people know about cushioning syndromes. Okay. Then comes fourth one is types of ADR in that type D ADR that is delayed. So in delayed means nothing but adverse effect may be presented many years after stopping a drug. So adverse reaction may be presented years after stopping a drug. So the patient is having a drug for a particular period and he have stopped that drug. But after few years, maybe a few months or few years later, the patient may cause adverse reaction because of that particular drug. So, for example of it, that is vaginal adenocarcinoma in daughters whose mom were treated with diethylstilbestrol. Okay. Uh, means in this diethylstilbestrol and drug was used by a mom, and later their daughter may develop what vaginal adenocarcinoma. So that this drug passes to the next generation, and that generation is going to face that carcinomic kind of effect. Means that this drug is forming a carcinogenic effect in next generation. That is what happened in delayed adverse delayed effect. Okay. So other types in last one is like uh, type E effect, that is end of the use. Reaction may be due to the sudden continuation of a drug. That is a withdrawal symptom. Very simply, we can say as a withdrawal symptom. So, if a patient is having clonidine as a hypertensive, antihypertensive drug, and suddenly we are stopping clonidine, that patient may develop with a rebound hypertension on because of this sudden stoppage of this drug. So and other forms of areas like dependency. So everybody know that the dependency means it's a state that alters the behaviors and mode of a person because of the It was means administration of a drug, repeated administration of a drug. Okay, that is very simple thing. Then laterogenic disease or adverse reaction is also called drug induced or physician induced. Means because of the drug induced disease is called laterogenic disease. Okay. For example, also isoniazid acid may cause what hepatitis. That is one of the uh, example because even after drug is withdrawn, the toxic effect may persist in that particular patient. So next one is teratogenicity. Everybody knows the fecal abnormalities, fetal abnormalities. So uh, everybody know, no need of giving more examples. There are also different stages and all those things, you know. Then comes what? Okay, teratogenicity, thalidomide, effect, and all those things. Everybody know. Last one is last few parts like carcinogenic means drug that can cause what cancer. For example, radioactive isotopes. So mutagenic. Next one is mutagenic. Mutagenic means drug that can cause genetic or example anti-cancer drugs. And hepatotoxins. That also everybody knows about hepatotoxins. Drug that cause hepatotoxicity. Then nephrotoxic drugs means drugs which can cause nephrotoxicity, autotoxicity. Uh, means with audiosity means our hearing problems. Then ocular toxicity means eye any adverse reaction. The drug which can cause the reactions to our eyes. So that's all. Thank you.